So my name is Dana Roebuck, and I am a licensed clinical art psychotherapist, licensed in New York State, but nationally registered, I guess. I went to school in New York and got licensed there, and I'm now working in Virginia in a residential program for children.
My name is Annie Coffey, and I did a lot of things to get to where I am. Clinical graduate training in psychology right after, I don't know, 3 years, I don't know, God, I can't even talk. 3 years after graduating undergrad. And I knew I wanted to be a psychologist. So boom, did that. And my dissertation involved poetry therapy, which I don't know if you knew that, Elizabeth. But along the way, after I finished that poetry therapy dissertation, I was going to become a registered poetry therapist. And I was literally at a crossroads. And I decided I don't want to be in my head so much prescribing like 1888 poetry to handle the issue of bereavement. I'm like, no. So I literally was fortunate enough, timing was perfect, to meet the person who became my mentor as a drama therapist in 2002. And that took me down the route of becoming a registered drama therapist in addition to licensed clinical psychologist, which is a juicy, wonderful combination. But what Dana does is even cooler in some ways because it incorporated, she was allowed to, is allowed to at her school, at her graduate school, to do all the creative arts therapies. Right, Dana? Basically.
Well, it wasn't expressive arts therapies.
Technically visual arts then.
Yes, technically visual.
Gotcha.
But I think it was mainly through my work with you, Annie, that I could see the intersection of the written word and drama, body movement, and all of those things before graduate school, that I realized that it all is so important.
Yeah.
And I don't think that I could function if I was told that I had to stay in one lane. Honestly.
Thank you. Oh, I'm so like Dana that way.
Yeah. And I think Annie, in what I learned from her, enjoys the organization, but allowed me sometimes through a frustrating process to be able to settle in the fact that it's okay not to have it all, like everything isn't prescribed in a formula, you know? It's kind of like the grace that you can experience with yourself, healing yourself while healing other people. And that's what, you know, anything therapeutic is it can be messy. Even today at work, they wanted me to find child artwork so they could frame it in headquarters. And I was like, honestly, a lot of the artwork isn't pretty. You make ugly artwork on purpose. And I don't really know what the corporate world is going to think about that. So in anyways, my working with Annie was very cool, but in a way, I think we hit kind of a moment where we realized that because of HIPAA and the protection of information with clients, that I wasn't allowed, and also being a minor, to be in sessions with clients, unless there was permission across the board, you know? And so in that way, Annie kind of, you know, in a boundary appropriate way, taught me what art therapy was by means of me acting as client. Okay. You know, there's different kind of assessments. There's the Mari card assessment, there's mandala assessments, there's body color cards, there's all of these tools that I felt were just like cool as hell. And it opened my world in a lot of ways that I'm so happy that I got, because the world that I was introduced to in New York was different, but I felt like I had a better, well-rounded view of what it could be because of what I had with Annie.
Just this summer, and everything via this instead of in person has allowed some very interesting things to happen, in that people have their own space, their own garage where they do woodwork, their own painting table, whatever. I listen for people saying what they're interested in or they're curious about, or, oh yeah, I'm building tables. Or, yeah, I just posted something on YouTube. I'm like, you did? Brand new client today is telling me that. And I jump on it quietly but gently. I'm like, oh, maybe you want to send me the link? Next thing I know, this person is like, absolutely hip hop, rap, blah, 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 direct. So I listen. How I incorporate it often with this kind of zooming doxy.me stuff is really never wanting to miss a single creative utterance and then jump on it. If they're in my office and someone says, I just felt like a pile of bird we're such words people in our field, right? We have to be. But if they're in my office, let's draw it. Oh my gosh, how would you stand? The drama part of me, whatever. That's enough. I mean, you get the idea. Yeah.
I really like that and connect to that idea a lot. The adolescents I work with, so I work in 4 group homes currently, and they're supposed to only be there 90 days. It's supposed to be like an assessment center. Some of them have come right out of juvenile detention. Some of them are in the foster system. Some of them are there because they're just waiting on a new foster placement. There's a lot of behavioral issues and trauma all stuck in one house. And so, especially with the adolescents, the boys in particular want to make references to things that they think will go over my head. You know, jargon, lingo, you know, all these things. And I see this dynamic where they're sort of communicating with each other outside of me. And there's this amazing man named Irvin Yalom, who's the group therapy god, who's all about the here and now. So you notice, okay, there's a group dynamic happening here. And instead of, well, maybe the first few times I would observe it and see like, okay, this guy feels like he's being the ringleader. He's manipulating the others. He's communicating something, calling that out in session and saying, so what's being communicated here? Is it important that the adults don't understand? Like those kinds of things. And usually I try to choose an art activity that will address those kinds of ideas of independence and secrecy and autonomy and individualization and all the things that adolescents will go through. But
that's fabulous. That's fabulous.
But part of the thing is, like what Annie said, this rich language is I do end up cursing with them sometimes or playing their chosen music, like not censored, because they have this wall where they think that things need to be clean on the outside of them or with the therapist or with females or maternal figures. But I think part of the barrier that I try to get on the other side of is nothing is too gritty or dirty or gross or macabre for me. So let's visualize the pile of shit, you know, really get it out there. And so, yeah, so that's what's been happening here. But in my work in inpatient psychiatry, a lot of that was there too. Sometimes I wouldn't lean into it as much because they might escalate and become dangerous, but there was a lot more drama playing that only my experience with Annie would have prepared me to do. For instance, this one woman would tell me at the end of each day, so I'll see you on the quad later, right? There's a house party. So she would say these words where in her mind, her environment, she was at college and I was a sorority sister. And through context clues and saying those things, the only way that I could form a relationship with her is playing into it, is to talk with her in that sort of thing and like be spontaneous and meet the client where they're at. So like what Annie was talking about, the patient feels like a pile of shit. I'm meeting you on the sidewalk, on the ground, where that pile of poop is. Let's talk about it.
How do you establish the validity of the art therapy?
I would say that there is a difference between, or it's a different conversation when you're discussing about the validity or use of art therapy with a client versus like in in a treatment setting or with the psychiatry department or with other doctors or social workers that you're working with. So something that grad school offered me was not only its application and how to use art, but then also the neuroscience that goes along with how art particularly helps heal. And a lot of it comes with brain mapping and knowing what parts of the brain are used and damaged in trauma. And like, for instance, traumatic memories are housed in a portion of our brain that only is sensory. So smell, taste, sound, touch, those kinds of things. And the connection between the sensory part and the verbal part of our brain is actually damaged in trauma. So artwork is an easier pathway than all of the processing that has to happen in order to form words to talk about trauma. So we can express emotion and feeling that we can't express in words visually easier, or some people musically, or some people dramatically, depending on what you lean towards. But so that's something that is really awesome, especially when you're talking to other clinicians, like you're talking about nurse practitioner. In the hospital, I was on a team with psychiatrists who had no idea what art therapy was. And,
unbelievable.
You know, it was also a teaching college. So I thought that that was cool too, that there were, you know, medical residents and students around that I could also influence in that way. But when it comes to, say, patients who didn't want to come in the art room because they weren't good at art, I would try to encourage them that this isn't about skill, this is about the process. And, you know, you can choose whatever you like to do or participate in our activity. It was challenging there just because there's so many different levels of like depression and psychosis and other things like that. But I would say my work at Bellevue Hospital and the substance abuse clinic was the most gratifying experience because I hosted groups with specific topics and the clients who came knew what they were coming into and choosing to be a part of it.
That's the thing I'm talking about. They know.
Yes. So there's a big difference in this conversation between choice and not having choice. So an outpatient and the clients who come to Annie choose to engage with her and choose to use her expertise versus people who are in residential don't really get the choice. Anyways, something that was really cool was getting to actually give a presentation to the psychiatry department about the applications of art therapy in psychiatry. And a lot of it was meeting the doctors where they're at, where they understood neuroscience more than they understood body language.
Yeah.
Wow.
So giving examples of what depression in artwork might look like, giving examples of what, say, dissociative identity might look like, or attaching artwork to diagnosis. And so I think it's a really undefined and unexplained field. And here I am in Virginia, finding myself in a state without a license for it, and being the only one at work that knows anything about it.
Yeah.
And here I was thinking that I was coming to like the land of fear, you know, having no standards of practice essentially. But like Annie was talking about, you have your own set of ethics and your own set of ways of functioning based on your other experience. And there's actually a lot of freedom when there isn't prescribed standards that you have to fit into.
I think in the last few years of me being in drama therapy, the North American Drama Therapy Association, NADTA, is all about research and a lot of qualitative versus quantitative research. But they realize we've got to be able to communicate for funding, right?
So I was wondering, do you guys like continue, like what does art look like for you guys outside of your professions? Like just kind of how do you use it in for yourself?
So a couple of weekends ago, I needed to go to my office on the weekend because I'm working out of home, and I went downtown and I knew I needed to make art. And I kept thinking, oh, who are the people who have birthdays in December? And I can make a piece of, you know, I needed to be in the world of art. I needed to play music on my big ass computer at my downtown office and have all my just Sharpies, but it doesn't matter because I have billions of colors. And I vibe with whom I'm creating something for. And it's suddenly very, very deep for me and creative, and nobody's piece looks the same. So I'm always very personal.
Oh, so I went to fine arts undergrad, and you know, when art became this kind of thing that was criticized or it had crits for, uh, I found that I was making art to the preferences of the people who were in the crit, you know? And I found that myself and my small, like, I think there was 12 people in the sculpture program, all of our artwork started to look kind of similar to each other, you know, near the end when we're having all of our senior shows and everything. And I kind of disconnected a bit. Also, what I really loved as a process, like welding and metal things, I realized I was going to lose access to once I finished school, you know, the tools to do so. So something that I got really engaged in was like textile work, because that's something that is accessible and available. And I felt like it had this very like maternal nature to it. And I found that when I use textiles, weaving, sewing, embroidering, whatever with clients, it usually evokes something nurturing in them too. It reminds them of their grandmother who taught them how to sew a button. It reminds them of something nurturing, and inherently just in the memory that comes up, it's healing. So you can see on this wall behind me,
Yay!
This room is chaos at the moment, but this is a collection of thrifted embroidery things / things that I've made. And I feel like I end up eventually always going back to something textile. But like Annie, I probably have limited time to be artistic myself. So I'm also working it into who needs a gift next.
Just if I were to talk to a client and they aren't a visual artist, or they aren't a musician, and they aren't a poet, you'll find creativity anywhere. It might be the way they like to dress. It might be the way that they actually love to garden. It might be the way that they create the whelping box for a dog and its puppies. I mean, I kid you not. And I like to connect with what I would call creativity as life energy. That is, I think I have radar for it, and I love it. Registered expressive arts therapist is just a whole nother way of combining all the stuff we're talking about, instead of just being a music therapist, just a drama therapist. And if I could redo my life, I would probably pick that path. Although I like having doctor in my title. You know, it's kind of nice. I don't use it. I just like having it. Anyway.
I think that something that's used a lot in my field is trust the process, where it might mean that where you end up isn't exactly what you thought, but the experiences you're having will help you choose your next role or your next position even better. Your current hardship now in your own life and with a patient in front of you or whoever is helping prepare you for the next one even better. So there's like this whole universal, like, your hardships are preparing you for the future. And that isn't something that I realized until I had a bunch of hardships to look back on.
Interesting. I'm going to piggyback off of the word hardships and say we should all embrace what stumbling blocks are thrown in front of us. Like if there's a goal and you don't get it, keep going. If it means something to you, you'll know you're supposed to keep going. You'll just feel it. I think that's the interesting thing about therapy and art and creativity, the process, back to Dana's words about the process. But I have another thought too, and that is, I think one of the biggest things, again, I'm almost 57. I have just the ability to relax around mistake making. Like, we as people, none of us is the same. And so we are a selling point. How we are more comfortable with ourselves and know ourselves is a bonus.
Exactly the words I was looking for when you first asked Elizabeth about the mentorship, is that when what you're expecting doesn't have a prescribed formula or a set of steps, it can be frustrating because you don't know what's to come. But Annie helped teach me that you can relax through the mistakes and kind of laugh it off or learn from it and move forward. And especially, like, personally, I suffer from performance anxiety all the time. This whole, like, I've got to come up with this brilliant art project that's going to teach them exactly what they need to know and say the right things. And there's so much when you can give grace to yourself and they're helping. I mean, you're all like learning and growing together. Relaxing through mistakes is really important, especially when you're kind of trying to marry these fields of very intellectual and very experiential. I just want to leave with this one last example. When I was working with Annie in high school, people would ask, what is art therapy? Like, blah, blah, blah. Can you give me an example? She had a client who I believe was a young kid who had experienced some domestic violence. And he created a little, like model, like clay model magic figure of him and his mother, or two octopuses on a surfboard, and then drew a picture of a shark in the water beneath them. And okay, like, that's cute or not, or they're scary or something. But Annie explained it to me that metaphorically, the little octopus with the big octopus was keeping him and his mom afloat, and the scary shark was his dad in water. And that being this like amazing example of like this, I assume, under 10 years old child, like, no way did he say, this is my mom, this is me, this is my dad. But when you can find those beautiful parallels, it is like jet fuel for excitement and moving forward with that case. I mean, that's just how I remember it. I could be off, but I thought that was an awesome, awesome example.